Welcome to our Wednesday live. I'm pretty sure today's Wednesday. Today's question that came to me was, do herniated discs go away? Sometimes people think they have them and they're going to have them forever. So I'm going to talk a little bit about what the herniated disc is to give you a little review, and then we'll show you some pictures of what can happen as a result of what we do. Typical spine, I don't know where my pen is. Typical spine looks like this. The head's here, the hips are down here. There's 24 vertebrae between the head and the hips. In between each vertebrae there is a disc. So the disc is in between the vertebrae. The disc allows for motion of the vertebrae. Each vertebrae is designed to move in 6 directions. The disc is like a jelly donut in the sense that the outside of the disc there's a thick material, and inside the disc there's a jelly-like substance we call the nucleus. Now what can happen is you can develop a little bit of a tear in the annulus, the outer portion, and through that tear the nucleus is going to move to the outside. And as the nucleus moves to the outside of the disc, that is what we call the herniated disc. So one vertebrae, one on top of the other. What happens sometimes is that disc can push out to the outside. Kind of looks like this. Should look like this. Looks like this. The nucleus is pushing to the outside, and very often that nucleus is going to pinch that nerve. It's going to cause you a lot of back pain, and probably 80% of the time it's going to cause pain down your leg as well, which is sciatica, which is one of the things that we treat here. So we know that the tearing of the annulus allows the nucleus to move to the outside, and as it moves to the outside, that's called a herniated disc. Okay? Kind of looks like this from the top view. The pink is the annulus, the gray is the nucleus. Gray will start to push out through the annulus. The nucleus pushes out through the annulus. That's the herniated disc. You can see it on an MRI. One vertebrae on top of the other. Typically what you want is a smooth transition, just like this. But what can happen now, you can see this is pushing out here. And that pushing out is also what we saw right on here. It's the herniated disc pushing out from the inside. So you can see the herniated disc on an MRI. Now with our treatment, what we do is we have we call it advanced physical therapy, okay? And I'll show you what that looks like. But again, nucleus pushes to the outside, pushing on that nerve. What we do is we take pressure off the disc. So we have you wear a harness and you're unweighted, and we kind of take a little bit of pressure off. We're not tearing you apart, but we're lifting you up a little bit, just enough to take the pressure off the disc, and then we have you do exercises. And what we have found is a combination of taking pressure off and doing exercises. We call it a functional disc stabilization, where we're taking pressure off and then we stabilize the muscles and reactivate the muscles. What we have found is the nucleus has a tendency to move back to the inside. Now, these are patients that came in to see us, and in this particular patient, he'd had a herniated disc for 5 years before he came to see us. Came to see us after 5 years of suffering with a herniated disc and sciatica, because he had a pretty large herniated disc, and he'd consulted 3 separate surgeons who all said he needed surgery. He didn't want the surgery, so he learned to live with it, which is common. A lot of people learn to live with their herniated disc because they don't want surgery. So he'd been living with this herniated disc for 5 years. Came in to see us, we did the MRI. Now here's the disc, and here's the nucleus. Nucleus had migrated through to the outside. This jelly should be in the center here. So we put him in the program. Taking pressure off, doing exercises. Taking pressure off, doing exercises. Taking pressure off, doing exercises. Put him through 25 treatments. We did a second MRI. With that second MRI, you can see he's probably 75% better. Put him through more treatments. Take the pressure off, do more exercises. Take the pressure off, do more exercises. We did that, and we did it for a total of 50 treatments. Now, 50 treatments is a lot. It's more than normal. Our average is probably about 30. Okay? So in his case, started with a 5 years herniated disc. His back pain was, I think, a 5. 5 was an average day. Some days were worse, some days a little bit better, but pretty much every day was a 5. And by the end, his back pain was completely gone. Sciatica completely gone, and we did this third MRI, and the herniated disc was completely gone. So in his case, went away. Another patient came in. When he came in, his herniated disc was so bad that he was stuck forward leaned off to one side and rotated and could not physically stand up. He couldn't, I found my pen. He couldn't physically stand up because he had a herniated disc. So we did the MRI. You can see, here's the MRI. In his case, half the disc material is in the spinal canal. I mean, it was a massive herniated disc. Put him in the program, okay? This is probably, we've seen one larger than this. This is the second largest. At this point in time, this was the largest. We've had one bigger since then. But came in, went in the program, taking pressure off, doing exercises, taking pressure off, doing exercises. And what happens over time, in his case, herniated disc completely went back to the inside. Completely, 100%. I didn't expect it. Completely went back to the inside. So they do get better. Now his took 80, but this is a severe case. Okay, average is about 36. Here's another one. Patient came in, did the MRI, found a herniated disc down here. Put her in the program, went through the program, take the pressure off, do the exercises. Did the second MRI at the end of care, found out the herniated disc went back to the inside. So herniated discs go away. You don't have to live with it, and you don't need surgery. Tomorrow we're going to talk about we're going to compare outcomes for our therapy to surgical outcomes, so you can see what the difference is. But today somebody said, really do this one about herniated discs. Do they go away? So they do go away. You do not have to live with them, nor do you have to do surgery. We can help. This is what we do. We specialize in the disc. We specialize in this area right here. Bulging, herniated, degenerated, stenosis, which is partially from the disc, and spondylolisthesis. More importantly, we treat a lot of sciatica. So the question is, was it just these three? We have 626 case studies that we have in a binder. And of those 626 case studies, 282 had herniated discs. Their beginning oswestry was a 45. Their ending oswestry was a 9. Beginning pain was an 8. Ending pain was under 1. Herniated discs get better. You do not have to live with the pain. That's the story for today.